doctor at Robinson Memorial. He opened a private practice and serves people in nursing homes doing long-term care and geriatric medicine. He's also spent 11 years as a hospice doctor, and he's going to speak to us about medication-assisted treatment in Portage County.
Thank you, Dr. Garrity. I appreciate the introduction. But how about that last talk? I don't know that my talk will be anywhere near as powerful and poignant as what Kelly Hart just shared with us. And I want to commend him for his strength and his courage in getting up here in front of you and telling you that it can happen. I'd like to give him another round, please. Okay, so as you know, I am the county coroner, and I'm here to talk to you about treatment in this county to the extent of medication-assisted treatment, which we're doing at Townhall 2. There are other programs in the county also, but we are a community-based, grant-based program that work through Townhall 2, combining both behavioral and medical treatment. So these are some numbers I wanted to bring to your attention initially. Kind of give you some idea of the motivation why we're doing this. 1 in 3 people in the United States today know somebody who is addicted to opioids. Now, everybody in this room may have more of a personal connection, but the next time you're walking down the street, you're at the mall, you're at the theater, look to your right and left. They know somebody who's being affected by addiction. This is from the American Psychiatric Association survey, national survey that was just done this May, 2018. 130 people die every day in this country from an opioid overdose. Every day. This is from the National Institutes of Health, the National Institute for Drug Abuse. These are current figures. These numbers are not good. When you get to the Midwest, these numbers get even higher. Our county, 30 overdose deaths last year and 31 suicide deaths. I include the suicides because I think we all know in this room that there's a significant overlap between these two diseases. This year, there are 28 overdose deaths to date, as of yesterday, and 20 suicides to date this year. And these are confirmed. We actually have 4 that are unconfirmed at this point right now, where the toxicology is not yet back. For every opioid death in Ohio, there is an estimated to be 40 overdoses that have occurred and 400 persons addicted to opioids. Now that's from the Ohio State Coroners Association, which I'm a member. That information is from last year. 0. This is the number of death certificates that I have signed due to Suboxone or buprenorphine. This is treatment that we provide at Townhall 2 as part of the medication-assisted treatment program. Dr. Spieth will be talking more about that particular drug during his presentation. So how did I get here? Back in March 2016, I attended a dawn meeting up at Holiday Inn, I think it was, in Brookfield. And while I was there, I had the chance, good fortune of running into somebody I had met before, Rob Young, who's with us today, who's with Townhall 2. And I had decided after I became coroner, because the year before I was in the coroner's office, we had less than 10 overdose deaths. And you can see what we had last year, the year before we had 47. And I realized that something had to be done. That I couldn't just sit back and keep signing death certificates of people who were dying of overdoses without trying to do something in our community. So I was set on opening my own clinic in the county, because at that point I didn't know a lot about it. I'm an internal medicine doctor. My specialty is not addiction. I'm not board trained in that. But I was determined to learn. I met Rob, and we started talking, and turns out Townhall 2 was looking for a partner also in order to do something for our community, for Portage County and beyond. Yeah, it took 3 years to get the clinic open. That's an up and down story. I won't bore you with the details, but there's a lot of paperwork, a lot of regulations that have got to be met. So Townhall 2, if you don't know, we're downtown Kent on Water Street. The CEO is Sue Whitehurst. She is our leader, and quite a leader she is. Rob Young is our clinical director, and then I am the medical director for the MBT program. So what I'm going to do here is kind of walk you through what it might be like if you came down to see us. Because part of what I hope we're doing here today is giving you an idea of how to refer people to us, to our program. This is the mission of Townhall 2. It's a little hard to read, it's particularly with the whiting it out, the lights whiting it out, but dedicated to meeting the mental health recovery and social service needs of Portage County residents since 1971. This is on our wall. This is the sign outside of our door, Opioid Recovery Clinic, Townhall 2, and these signs are throughout the space when you come in, so that you can find exactly where you're to go. Townhall 2 is a 2-story building. On the first floor, behavioral health services, which Rob totally aces every single time with his highly competent people who help to do the behavioral end of the care, and then upstairs, we have the clinic. Used to be a free clinic. And then with the passage of the Affordable Care Act, it became kind of moot because insurance was throughout the land. Let's hope we don't have to open it up as a free clinic again. This is our waiting room as you walk in. As you can see, if you've ever been in a doctor's office before, it should look pretty familiar. We want this to be a comfortable experience for people, a welcoming experience, and a dignified experience. One thing Kelly referenced that I think is so important is removing the stigma. That's out from my perspective and this clinic's perspective. We're not here to judge. There's my nurse, Tracy, sitting down with Barb, who's the CEO, executive secretary for Sue Whitehurst, working in Tracy's office. Tracy is an integral part of this. She has 20-some years of experience in addiction. She's worked for Conquest in Stark County. She actually worked with Portage County Jail at one time in helping people. And she just brings a wealth of experience to us. And she's everybody's mom, I will tell you, when they come into the clinic. She is a welcoming here. One of our exam rooms, where the appropriate targeted physical exam is done before anybody is treated. Of course, before they come in, we do a complete history, trying to put together their health history, because it's not just about treating their addictions. It's not just about the opioid use disorder that we put down as the diagnosis. It's really about a total health program that we're trying to provide to these people, these individuals. The restroom, this is where samples, what we refer to as drop-in urine has to be done. If you look in the upper right-hand corner, you'll see a mirror there. These are observed. We have regulations that we have to follow, and everybody who comes to the program understands that at some point, from time to time, intermittently, they will be providing urine samples for us, because we want to make sure that we trust, but that we verify. This is the laboratory where the samples are tested. We actually test for a multitude of different agents, both prescription and illegal, so that we can assure that the client is on the right track. So this is a room that isn't quite yet utilized. This is going to be our induction room. And what we're hoping to do when we get to the point of certification through both the federal and state government is that we'll be able to bring people in and they will be able to go through withdrawal in our clinic under the watchful eye of both the physician, practitioner, or the nurse. The process is a 2-day process, generally speaking. The idea is to bring somebody in first thing in the morning. They likely will be going through a mild withdrawal, or they may have already taken something that morning, and then we will observe them. We'll take their vital signs, we'll make notations. There's a scale that we use to determine what point of withdrawal they're in, and then we'll start giving them medication. So what happens right now, being an MAT clinic that's certified through the state of Ohio, I prescribe a medication, Suboxone, most likely, not exclusively, we'll get to that, for our patients who are in withdrawal or have gone through recovery within the last 30 days, basically withdrawing from medication, or they're currently taking medication and want to get off of it. The idea is to help with their cravings. Where we want to go with this is an OTP, opioid treatment program, or outpatient treatment program. That takes us to the next level. One of the photographs I neglected to put in here was that of the safe that we have in the building that has to be big enough, according to federal regulations, that no 3 men can walk off with it. It has to be behind a locked door and has to have a camera on the door. So a lot of effort and time has gone into preparing this site for the program that we have planned. Now, at that point, when we become an opioid treatment program, we'll be able to actually have Suboxone on the premises, and so that we can treat people in the induction room. Right now, I make an assessment, I write a prescription, they take it to the pharmacy. Often for their very first dose, they bring that one dose that I prescribed back to the facility, and we observe them taking it to see how they'll respond to it. We certainly don't want to do any harm to anybody by giving them a medication that they can't tolerate. As time goes on, people return to the clinic to be evaluated and given their future prescriptions. We have some people who get a prescription every day for a week or 2 or more. We have some people who are transferring into our program who have been going to Canton or Akron or Youngstown or Cleveland to get their medication. So they can come in, and we have a bit more history on them. That's part of what we do. We do the history and physical on the patient to make sure that the program they're in, they're at the right dose, and they're having some success. Those folks generally don't need quite as much oversight as we're starting to prescribe medication for. So what we provide, again, is counseling and medication for addiction. The behavioral treatment, the intensive outpatient program, part of it, which occurs on the first floor under Rob's tutelage, and then the symptom management, medication, which happens on the second floor, which is what I'm responsible for. These, to my knowledge, these are the 3 medications that are approved for the treatment of addiction in the United States. So buprenorphine, with or without naloxone, we call that Suboxone, with the naloxone. And again, Dr. Spieth is going to talk more specifically about these drugs. Naltrexone, which is a drug that is an opioid antagonist. It sort of stops the opioid from working in the system. You may have heard of Vivitrol. There are 3 to 4 week injections that can be given, but it's also given by mouth. When we initiate this medication in the facility, again, we have them get their first dose, the oral dose, they bring it back, and they take the medication under our observation, so that we can make sure that it's going to affect them in the way that it should, and not adversely. And then methadone. Now, methadone is grayed out here a little bit because we cannot provide methadone through our clinic. As an outpatient treatment program, opioid treatment program, OTP, we could do that. Methadone is a little bit trickier It's a very complicated drug. It has to be prescribed very carefully. It is a daily dosing. So the methadone clinics that surround us in surrounding counties, the individuals who are taking their methadone need to present daily for their dose, except for Sunday. The clinic can't close on Sunday. It's a 6-day-week program. It is very much operating for more than just 8 hours a day. You can imagine the complications and the complexity involved in trying to manage methadone for folks who are trying to live their lives and work. So this is a busy slide, and I apologize for that. I hate busy slides myself, but this is the referral criteria for MAT, adapted from SAMHSA, which is the Substance Abuse and Mental Health Services Agency arm of the United States government that helps give us guidance into how we should be running these programs. And I'm not going to read it off here, but you can see that we have a certain criteria that need to be met. And that includes the client's buy-in. They have got to agree that they're going to work our program with us, that medication isn't a magic pill. Behavioral modification is essential in the treatment of these individuals. Opioid use disorder does not have a cure, but we have a treatment. We don't expect people to magically stop their medication in a month or 6 months, a year. Statistically, research suggests we don't even ask them if they want to get off for a year. We need to get them stabilized. My goal, and you've heard me say this before if you've attended the seminar before, is to keep folks alive and functional. People can work. They can lead their lives. They can work towards sobriety without the cravings and the need to go to the street for the drugs. This is a flyer that has been in the paper. It's been around town, and we have a stack of them out at the table about our opioid recovery clinic. You can see a phone number there. We're the crisis line for the county also, so they're open 24/7. So this is Denali. I put this in here because for many people, beating addiction is climbing a mountain. This happens to be one of the most difficult mountains in the world to climb. That's because even in the summer, the temperatures are 20 to 30 below on this mountain. It's about 200 miles south of the Arctic Circle. Mount Everest is at the same latitude as Disney World. So beating addiction is hard. Nobody ever thought it was going to be easy, but we have tools and we're getting better tools. And as we move into the future, I am confident, to use Dr. Goldman's reference, as industry is being brought to this problem, we will find more treatment, more help in that regard. It's just the way it is. This is my granddog. And he's here today to say happy Halloween to you. This is Kirby. And in fact, his mom, at least his human mom, is with us today. She's Laura. My new daughter-in-law is a counselor out of Waterloo. So I thought I'd invite part of this conversation with a happy Halloween wish to you all. If you have any questions, don't hesitate to stop me here. Call Townhall 2. We're happy to answer any questions and help you with your referrals. I think we'll probably save questions for after Dr. speaks so that he can see his piece. And if you have any questions, I'll be here. Thank you.
Jump with the gun.
Thank you, Dr. DePerro. I want